For years, Michelle Gerhardt suffered from the symptoms of chronic sinusitis. Antibiotics would help with the infections, but she says they always came back.
I had gone to a multitude of doctors throughout the years. I used to see an ear, nose, and throat specialist. And last year specifically, I got very sick, and I was sick probably for a period of 3 months, and I'd gone to a multitude of doctors, and I finally got so frustrated. I saw an allergist who was the one who really said, you know, I really think you need to treat this for what it is. I'm a big referral relationship person, so I had asked a coworker who struggles from the same symptoms, and she had gotten the referral from a friend of Dr. Pritikin. She had gone to Dr. Pritikin and said that she had a positive experience, so I picked up the phone and called him.
So Michelle had what I thought were fairly classic symptoms for chronic sinusitis. Her examination revealed a deviated septum, and her CT scan revealed narrowing of the sinus openings as well as fluid in the sinuses in the cheeks. After discussing her symptoms and going through different possible treatment options, I recommended balloon sinuplasty.
Dr. Jordan Pritikin directs the Chicago Nasal and Sinus Center. The procedure he recommended for Michelle's surgery has been shown to be useful in a large number of patients with chronic sinus problems.
I feel that balloon sinuplasty is appropriate for patients with recurring sinus infections in the absence of any diseased tissue and in patients who have sinus pressure headaches. The advantages include minimal risk of trauma to the tissues, decreased risk of injury, decreased bleeding, minimal discomfort, and a shortened recovery time.
The fastest decision I've ever made regarding a surgery my entire life. Knowing that the recovery time is far less and it's not as an invasive surgery as the I guess older way of doing that surgery, so it was a no-brainer.
On a Friday, Michelle arrived at St. Joseph Hospital for the balloon sinuplasty. The procedure takes about 30 minutes and is done in an operating room using anesthesia. The goal is to insert a guide wire through the clogged opening, then to move a small balloon catheter along the wire and into position in the opening. Dr. Pritikin inflates the balloon for a few minutes, widening the opening.
The first generation of balloon catheters simply enlarged the sinus openings, but didn't address any disease of the tissues. The present generation of balloon catheters include the use of drug-eluting catheters that can be filled with medications such as steroids that slowly bathe the tissues and decrease inflammation over time. Dilation of the sinus opening may not be sufficient to address inflammation and swelling of the lining of the sinuses. The Relieva Stratus catheter is placed after the sinus opening has been enlarged with standard balloon devices. Once deployed, small collapsible wings hold the stratus in place. The stratus is then inflated using a dilute steroid solution. A small one-way valve within the device prevents backflow as the balloon inflates. The deployment guide is withdrawn and is cut such that only a small segment extends from the sinus. Tiny micropores allow the medication filling the stratus balloon to slowly seep into the tissues, providing sustained release over a 14-day period. Once the stratus catheter has emptied, it can be removed easily in the office.
According to the doctor, recovery from the procedure is fast, and some patients experience almost immediate relief.
Within the hour of me coming out of recovery, I was sitting up drinking cranberry juice and eating graham crackers that I could taste. It was amazing. I had no idea that that would be something that would happen that quickly. All of a sudden I was breathing out of one side of my nose that I had no idea I was not breathing out of. So the surgery corrected an issue that I didn't even realize I had. I had no idea how much I was struggling to breathe until all of a sudden I was breathing.
Worldwide, over 80,000 patients have been treated with balloon sinuplasty. No serious complications have been reported, and 2-year follow-up studies have shown better than a 90% success rate with balloon sinuplasty.
The staff at the hospital was fantastic, and Dr. Pritikin was awesome because he has all the tools there to show you exactly what he's going to do. He did a great job of explaining to me how it was going to go. There was nothing different. There were no surprises. I would do it again in a heartbeat.